Ian put on this week. They've been amazing sessions, haven't they?
It's been a busy week.
It's been a very busy week with everyone. So this week is really, today is the final day of Small Charity Week. And if you're not already logged on or registered for the session this afternoon on Govern It, do that as well. And that'll be the final event for a fantastic organized week by Ian and Noika. Just a quick reminder, the session is only 1.5 hours long. I'm going to ask everyone to turn off their sound while our presenters present, just to avoid any background disturbance. That would be really kind of you. And if you would like to speak, if you could raise your hand and I'll keep an eye out. And at an opportune moment, we will call on you to share what you need to share. We've got a fantastic lineup today. So Lynn, I see, is here already. Hi, Lynn. Nice to see you. So Lynn's going to talk about the impact of COVID on family carers. Lynn's well known to everyone in the carer community. So I'm going to, at this point, hand over to Lynn, although I'd like to welcome Mystica as well. Hi, Mystica. Are you here? I can't see you on the list.
Yes, I'm here. Sorry,
hi.
Camera. But
hi, that's okay. It's really nice to see you. Haven't seen you for years.
Yeah, it's been a while, hasn't it?
Yes, yeah. So, Lynn, would you like to take over from here?
Yes, I'll be happy
Thank
to do
you.
so. Hi, good morning.
I'm going to stop sharing. Do you want to share your slides?
I don't have any slides.
Oh, all right, that's fine.
I thought for a change,
yeah,
I would go non-slide, if that's okay with you.
Of course.
It's probably a bit disconcerting to think there's no slides initially, but
oh no, the floor is yours.
Okay, lovely. Thank you very much. And also thank you very much for inviting me as well today. As you say, my name's Lynn Hammond and I've worked and lived in Hounslow Borough for my whole life just about, and mainly in the voluntary sector, supporting various charities to support people. And currently I'm working at London Borough of Hounslow Council supporting family carers. So that is my role. Just to start, really, I was going to say, imagine when you go and get your week's shopping and you've gone through the shop, you've got to the checkout, you've paid for your shopping and you've got your carrier bags in your trolley, and you set off from the shop with your trolley, and then you put the trolley in the trolley park and you go to lift 2 big full carrier bags of shopping out of the trolley. And as you start to lift them, it hits you. Boy, I don't know what I bought, but this is heavy. But you carry on, you start walking through the car park, and every now and again it just gets a bit too much, and you put them bags down and you rub your hands together and you pick them back up, and again you go on a bit further. And sometimes you've probably all done this, you put your bags down and you swap hands because somehow you think maybe in the different hand this will feel a bit lighter. Imagine the scene, you've got this shopping, you're going through the car park, you don't know how you're going to get home, and suddenly you hear a voice calling you, and you look behind, you put your bags on, and it's somebody from the shop coming towards you with another bag. And something written on the side of it, but you can't see what it is. And then he comes up and he says, "This is for you." And he puts it down and he turns and walks away. Now you were already struggling with the 2 bags you had, and now you've got a 3rd bag, and you just don't know how you're going to manage. Now, in reality, that's exactly what it's been like for families who are trying to look after somebody at home with a disability during this period. Life was already challenging, difficult and tough, and now you've been handed this extra bag. In fact, when you look at it more closely, that bag's got written on the side of it, COVID-19. And you're wondering how on earth you're going to manage to get through this period of time. So in order to do this presentation and avoid doing a slide presentation, what I did was I emailed 163 carers, some I've known for many years through the borough and helping and supporting, just to get their feedback. What's been your experience? Because I could talk forever, but we want to hear from those people it's really affected. And that's what I'm going to give you today, is what has been the experience of carers across Hounslow Borough during this period. Now, as you can imagine, there's good and bad, there's negative and positive, but sad to say, the negative and the bad do tend to outweigh the good experiences. So I'm going to start, I don't normally do this, I normally try and start with the good, but this time I'm going to start with the bad, because as I say, it does outweigh the good. So I've tried to categorize the replies that I've had, and a lot of themes come through. A lot of people's experiences have been much the same. For example, fear. The constant and ongoing fear that the person that they love and care for is going to catch COVID. A general anxiety about the carer's own health, because actually if something happens to the carer, who's going to look after the person they care for on a day-to-day basis? These risks and anxieties have increased greatly during this COVID period. There's also been a fear of accessing medical help, even if you identify that it's needed. When a family member ends up in hospital, you can't visit them. You're worried they're going to catch something. And sadly, I've experienced many calls from carers who've lost their loved ones due to COVID. In fact, some days it's been call after call, and it's been really quite difficult to cope with at times. Some people have had other issues as well. For example, a lot of the cared for people's health has declined during this period. One carer said that her mother's mobility has declined 60 to 70%, and others have said that people have gained weight, and that in itself brings other health issues and challenges. Some of the other things that have affected people has been obviously a lack of services and support. So it's only natural that a lot of the things that people might normally access have either been put on hold or suspended. Day centres have been closed, activities have been held back, respite's been closed, and the things that people would normally have that would keep them going have just been cancelled. And in the early days, you know, a lot of carers cancelled the paid agency staff that were coming in to get their family member washed and dressed, thinking, you know, you don't know what they're going to bring in, I can do it myself. But of course, this COVID's gone on longer than any of us expected. And so now people are at the situation where they can't actually cope on a day-to-day, and that they're having to weigh up some of these things now. These have been a really ongoing situation for our carers, especially in Hounslow. Some other issues like PPE. Imagine trying to get somebody that has been shielding at home to come out into the community and wear a mask, and they've got dementia or another disability. I know, for example, I care for my mum, and the first time I took her out, I was like a parent. Don't touch this, don't go here, don't do that. Got her out of the car, handed her a mask, went to clean the trolley in the garden centre I was taking her to, looked round, she'd got it over her mouth, her nose and her eyes, and was just standing by the car. Some of these things that we come to take for granted, like putting a mask on, can be a massive, massive issue when you're trying to care for somebody and keep them safe. Appointments. Of course, people need appointments. But a lot of people's appointments have either been cancelled through no fault of their own, or they just haven't been able to get appointments. One carer said, I've had no GP face-to-face appointments for over 15 months, and my wife has been hospitalised 6 times. It's very difficult, isn't it, to try to describe to somebody over the phone the size of your mum's leg or how much pain she's actually in now. By far the biggest negative feedback from our carers was things like isolation, being cut off and feeling lonely. One carer said, it's turned me partly into a recluse. I've not left the house since the beginning of last year. and now I find it difficult to cope and communicate with people. I've missed opportunities to socialise with people face to face, one carer said. It's been hard keeping my mum indoors, said another. I've missed just being able to choose my own food, said another person who's had somebody getting their shopping. Overall, others have said there's been a constant feeling of being exhausted. Some without gardens have found it claustrophobic, being in 24/7, loneliness, depression, anxiety. One said the words trapped and not coping come to mind. I couldn't see my friends who keep me cheerful, said another carer. And these are the things, the theme that comes through these again and again. It's obviously gone on a lot longer than any of us thought. And actually, even over the past few weeks, I've got carers that have come to me with a new range of problems. These are working carers who've been on furlough and have actually been made redundant. And now they're struggling to work out how they're going to balance things. There's a lot of people with financial difficulties now that are actually leading to a lot of problems. So that's some of the negativity. And we're looking now at the positivity. What good has come out of this? Well, I think you could honestly say that for some people, staying at home and not having to go out has been, one said, less stressful. I've learned to build up better communications with people, said another. I feel secure at home, said another. Personally, I've enjoyed not going out to such an active social life. Things have been simpler, and I think my husband's appreciated not going out apart from the garden, said another carer. Secondly, people have learnt new skills. Now, when you think about it, a few years ago, if somebody said the word Zoom to you, you would associate that with a car flying past you. But actually now, Zoom's on everyone's tongues. A lot of people gave this feedback. I've learnt Zoom. On the plus side, I've learnt Zoom and many other things online. I've learnt Zoom and Microsoft Teams again and again. I've set up a group for some carers on WhatsApp, said another. Another carer said, I've worked hard with staff at our son's care home to do video calls twice a week with him. Some have said that they've learnt new ways to communicate with people and family living abroad that they'd never known before. And it's opened doors so that they can actually continue doing these things going forward. I think I've saved the best till last. I hope so. You know, when we started, we spoke about you being in the car park with them carrier bags and somebody's giving you another one and you're just standing there thinking, what am I going to do? Imagine this. A familiar voice calls out to you. Are you okay? Do you need a bit of help? You look round and it's your neighbour. Yes, please, you say. Come on then, they say. They pick up the heavy bag that's been put by your feet. They take one of the other bags off you. Let's get you in the car and get you home. Within minutes, you're in the car, you're back indoors, you've been rescued. And that's something that's come out from a number of carers. They've said the following. I was touched with how many neighbours knocked on the door and offered to do shopping. They were very caring. Our neighbours have set up a WhatsApp group so we can keep an eye on each other and help each other. Neighbours offered to get shopping and were helpful in bringing supplies. Neighbours were good and friends have helped. And lastly, and I found this one as well, from my own experience, chemists have stepped up to the plate. And a lot of them have been helping by delivering medication. And that's really taken a lot of the sting out of trying to get medication from places. So that's my presentation today and my feedback from our carers. Obviously, we can't change the past year that we've gone through, and we've no control over what happens to tomorrow. But I just think on the positive note, if we can share our experiences with others, if we can help others as best we can, then obviously accept help when you can as well. then obviously it makes what we're carrying a bit easier to carry. Thank you.
Thank you so much, Lynn. That was just brilliant. You definitely didn't need PowerPoint. Absolutely not. And so I think it would be good at this point to ask everybody to share some of their experiences and what they've heard from people they know who are carers, and just focusing, as you said, on the positives that have come out of it. Because at the end of the day, although it's been a really long and hard year, I think there have been some positives. It's been so tough for so many carers, and I work very closely with a number of families who are in caring roles in my role with the Houslow Parent Carers Group. And we've seen the impact of COVID on our families in so many different ways. But I know that there have been positives as well. We've seen families being able to focus on and nurture the members of their family, and not rush around from one meeting and one event and one appointment to another, and just have time to build relationships which weren't there previously. So there have been fantastic positives as well as some really, really tough times. So I wonder if anyone would like to ask Lynn questions or share some of their own positive and amazing stories. Sharonjit, I see you. I'll ask you now. I see Barbara's here as well. That's great. I'll ask each of you. And just before we carry on to that, while we're all continuing, can I remind you that we'd like you to put your email and contact details into the chat if you'd like to network with people on this group. Lynn, are you happy for me to hand over to some of the members of the audience?
Yeah, no worries
Okay,
at all.
so Sharonjit, would you like to go first?
Yeah, good morning, Lynn. Good morning, everybody, and good morning, Digital Jane. How are you? Yes, we did, as a Sunshine of Hanslow organization, we did support the carers a lot because they were struggling, and because they couldn't get the support due to lockdown, and they basically sometimes they harm themselves because they think enough is enough. My mom can't go anywhere, and due to dementia she's talking all the time, and she's shouting middle of the day and night, so the carer couldn't have a rest at all. So the carer was doing shopping, also looking after mother, trying to do everything with her. So what we did during the pandemic, we dropped them food shopping vouchers, so they could shop on, their children could do the shopping online for the parents and the caring mother as well, so that helps them to ease off. Also we did a lot of food deliveries to these carers, so they didn't have to go out to do their shoppings, and a lot of them needed more of the nappies, the pulled up nappies. So Home Bargain was the best place to buy the cheaper nappies. So I used to buy like 10 packets for the family, so at least they can carry on for like a month or two for their loved ones to, you know, carry on. So they didn't have to, the carer didn't have to do much shopping, so she didn't have to go out too much, although the carer is 60 above as well, and the mother is 80 or 90 above, like something like that. Another person in Feltham, she is caring for her autistic child. I mean, it's brilliant. The council has given her the house, is brilliant, but she had to move overnight, and something like that. She had to move so quickly, and that mother is struggling with the child, and also trying to bring her house up to date, and also trying to settle down in the new house. I went to see the house. She even sent me the video. There is a mess all over in the house. Mother is working day and night, and she is not looking after herself. She's not feeding herself. So, I mean, I go to Feltham once or twice a week to deliver her plenty of food, and a lot of ready-made meals, so at least she can just heat up and eat it. She can't use her kitchen, she can't use the sitting room, she can't use the bedroom, but she settled down the one room where her child sleep, and she's sleeping on the mattress every day. I mean, we need a more support as through the council. We need more of a handy people to go and support the carers, although we as organizations doing so much running around, endless running around, but it's not enough. We can only do so much. We need more of a handy people who can go and support the carers to make their life on ease. And also the things they can't do while they're caring for somebody, they can't keep up the house, so they need to, like, somebody to go and cut the grass, somebody is to do, help them to do the paint in the walls and things like that, you know. So I mean, it's a very distressing time. I mean, due to COVID, it's very distressing for us normal people. Imagine when you're caring for somebody, it is very, very hard. It's going to take them such a long time. You know, we are trying to engage so many people to do online Zoom activities. We can't because they are really hard for them to get out of their shelves, and also it's very hard for them to engage with the people. Mentally they are drained already so much. It will take them long time to get out from their system. Also they're getting support from organizations, but we can't do everything for them, but there's a lot of things needs to be done for them. I hope the council can do something more extra for these carer people.
Thank you, Sharon Jeet. Do you know how to put your hand down?
Yeah.
Great, thank you. Lynn, do you want to respond?
Yeah, hi, it's good to see you again, Sharon G, and also hear of the good work that you do, and I know that you always go the extra mile for people. With regards to a couple of things there, with you mentioned nappies. If it's you can try to go through your GP to get the district nurse to have a look at the situation for adults that might need to wear continence pads. And they should normally do an assessment, and then they should provide them for the person free of charge and deliver them. But they have to do an assessment first from the continence service to save people trying to buy them.
I know all this procedure myself because I have some condition as well, but they don't give you pull-ups nappies. They give you every other pads. They don't give you pull-ups once you have to buy. They said you have to buy the pull-ups one. Even yesterday, somebody got a cancer, and his wife is also old. They're both living, the pair of them living together, and she can't get out while he's got a cancer. So I bought 10 packets for them to go and deliver them to them. Yesterday I bought them.
Thank you, Sharon Jeet. Sharon Jeet, I wonder if we could talk about specific cases outside of the meeting, because that would be helpful. Thank you. Sorry to interrupt you.
Another thing as well, just as you've mentioned somebody with cancer, obviously there's the Mulberry Centre, and Macmillan do a grant as well for helping people affected by cancer if they've got specific needs, so that people can actually have some money towards something like that if they need a specific product. Usually the Macmillan nurse or somebody at the Mulberry Centre can fill in that application form. You mentioned as well about a mum moving into a house and the condition that it's in. So she can contact the My Independence Service on 0208 583 3942 if she has specific housing needs. Now, there is a handy person service, but they don't just come around once a week cutting the grass, it's true to say. There is the Good Gym project, There are a number of projects that will help with things like that, doing, you know, a once over in the garden, a quick emulsion up for these kind of specific one-off hit jobs. The Good Gym are good with that. If the person's got a social worker and they're struggling to kind of keep up with everything, then they can do the referral to the Good Gym for that person. But if it's a specific housing need, so if they've moved into that house and it was filthy and like a pigsty, that should never have happened. So any problems should have been put right before the person moved in. So the best people to contact is My Independence on the 3942 number, because then they can look at who the housing officer is, who the allocations officer is, and normally they take pictures as well. So if there was an identified issue and they were going to allocate a property to somebody, they take pictures of the property, the issues rather, so that they can actually have a record of when that's been put right. So it would be the My Independence housing piece that would be the best people to look at what that particular lady's dealing with in her property. I mean, obviously, if you get given a property and it's got a garden, and you've got children, you know, that's great, because there's millions of people that want a property with a garden, but you can't always just get the council to come around and cut your grass for you, because that's not something that's going to actually happen. If you get a garden, really, it's your responsibility to be cutting your own grass.
Lynn, could you put the contact details for My Independence? Sorry, I didn't catch the phone number.
On the chat
If you
thing.
could, on the chat thing. And while you're doing that, can I ask Barbara to share what she wanted to? After Barbara, we've got Janine, and Janine has shared something on the chat, and I'll go to her after Barbara. Thank you. Barbara?
What I wanted to say first is that Lynn is brilliant, and I don't want to send all the people in Hounslow to her because she won't be able to cope. But the one thing that I want to share a couple of things, but one thing that Lynn always does, and I would like to encourage everybody in the voluntary sector to do the same, is to do what she says she's going to do. One of the most frustrating things is that you have a meeting with a social worker and things don't happen, or you ask for something and they don't call you back, or somebody new calls you back. And I know that the independent sector is really committed to supporting people, but as part of the training and all the messages that you give to all the organizations is to please follow up on what you say you're going to do, or if you can't do it, or if there's a problem, call the carer back and tell them that you haven't been able to do it, because it just makes you crazy along with everything else. And the second thing is that there are so many, for the first time in a really long time, the council is supporting all the voluntary organizations and putting, there's so many groups starting up. And it would be really helpful if you could share information between you so that you know where to refer somebody. There was a philosophy in the council, which we seem to have lost, which was make every contact count. So if you're dealing with them for food delivery, but you know that there is a handyman scheme or this or that, or this organization can do something, it's really helpful to share it. And the third thing that we've missed so much is activities, things to do with the cared for person. And they're all starting up again, walk and talk, and just things that, help the carer not have to do all the things. Maybe there's a little entertainment or a walk or something that isn't the normal in-house things that is very valuable. And the carer's email does try to make that available to people, but maybe you can forward it on to your own clients or do things like that, because the Wellbeing Network has quite a bit of walk and talk and things that are outside. And I know it's difficult now, and you never quite know what you can do and you can't do. But just being able to see someone else, to be outside, not today, mind you, but so those were the three things I wanted to say.
Thank you so much, Barbara. Lynn?
I just mentioned, thanks Barbara for that, and she is right. It is challenging if my phone number's on everything, because there's a, you know, the days are getting longer. I feel like obviously I'm working from home. I seem to be here 24/7, but you may have heard of the social prescribers. Like Barbara says, we've got a few new projects coming up in Hounslow, and some of them have been on the go for a wee while, and some of them have now expanded. And we've tried to get a bit more of a philosophy of making carers everyone's business. And something I always feel passionately about is not palming people off to somebody else just because you think the problem's too big to take on. So the social prescribers, if you come across people and they have got issues that are not medical issues, then the GPs can refer to the social prescribers. Now, there's about 18 of them now across Hounslow Borough. There was only 5 to start with for the last few years, but more lately they've got a new manager and there's 18 of them. And what this does is they can take on a piece of work that is around other issues, like you say, with the handyman thing. Is there someone that can do this? So somebody goes to the doctor if they could get in or get an appointment, and they say, I'm not sleeping, I've got this massive issue, I'm trying to look after kids, the grass is growing, I'm not getting my shopping. None of that's actually a medical issue, and that's what the social prescribing service is all about. This isn't a medical issue, therefore the social prescribers can pick up that work and they take it on as a case. One of the challenges currently is that they won't fill in any paperwork. So if somebody wants a benefit or a blue badge, they can't do that, but they can take on some casework and help people to get some good outcomes. So there is a lot more going on. We just obviously, and I agree with Barbara, what Barbara says, we just actually, instead of all working differently and a lot of things being duplicated, we obviously just need to be a bit smoother, if you like, and work together a bit more. But with new things, it does take a while for things to get embedded in and for them outcomes to come about. But I'm really happy to think that there are a lot more people out there supporting our carers as well, you know, making carers everyone's business.
Thank you, Lynn. Before we go on to Mystica from Health Watch, I just want to look at what Janine wrote in the chat. She said there are some positives. We've appreciated nature more. We've been able to build relationship with small numbers of people. We've been able to enjoy the parks and open spaces, mobile coffee vans, and each other, to communicate with sharing COVID news for members who are not literate and who might have missed updates. So there have been positives working in small groups. Thank you, Janine. I just make sure that that's it. Mystica, can we hand over to you? Thank you so much for coming along. Mystica is the operations manager at Health Watch Hounslow, and she's going to tell us a little bit about what they found in their research about the impact of COVID on members of the BAME community.
Perfect.
Very relevant to this. Right, Mystica, over to you.
Great, thank you. I'm going to ask Zainab to actually share my screen. Sorry, share our slides. While Zainab does that, I just wanted to add that a lot of what Lynn has said is very similar to what we have been hearing from residents the past year. So how residents have gone through life-changing circumstances, from job loss to changing living situations, not being able to see family and friends. So we continue to hear these issues with healthcare access, especially. And through our information and signposting service, we have also found ourselves on several occasions working outside our remit, for example, making calls to GP surgeries and finding out it's an absolute nightmare to get through. So we are coming across these issues as well, but we continue to work with residents and listen to their views. Okay, perfect. Thanks, Zainab. So just to warn you, my Zoom does go a little bit funny. So if it does, please do let me know. So I just want to say thank you for inviting us and also giving us the opportunity to present. So I would like to introduce myself. I'm Mr. Burridge, the Operations Manager at Healthwatch Hounslow, and I'm going to introduce my colleague, Zainab. Do you want to introduce yourself?
Hi everyone, I'm the new Engagements and Project Officer. I'm fairly new, so I still got a lot to learn, but thank you for having me today. And yeah, I look forward to hearing your views. And yeah, we're going to get cracking on with this presentation.
Perfect, thank you. Okay, for those who don't know what Healthwatch does, we're an independent organization and we listen to people's experiences of health and social care services in Hounslow. So that their views can be obviously used to make services better. Part of that is providing information and signposting as well to help people navigate their way around health and social care system and to also understand what to do when things go wrong. So we do provide evidence-based feedback to commissioners and providers to influence, inform, and if necessary, challenge decisions and plans. So back in May 2020, we decided to carry out a survey to find out local people's views about the coronavirus pandemic. So we quickly created a survey in response to the pandemic with the aim of finding out how residents were coping during this difficult time. So the survey was developed with our colleagues from the CCG. We also engaged with various partners, for example, the voluntary sector partners, patient reps, local authority, and the CCG primary care team. The survey was launched on SurveyMonkey, so from 26th of May, and it ran until the 1st of July 2020. So people were also given the opportunity to speak to us over the phone to complete the survey. So we know there were limitations with the survey, and I will come on to that. And Zainab, if we can go to the previous slide, please. The one before that. So we asked residents to share their experiences about several topics, so including physical health and access to services, mental health and well-being, personal and family relationships, environment and finances, communication and digital technology. Next slide, please. So from the survey, we actually received 3,310 responses, which was great response rate. And from those responses, 1,049 identified themselves as Black, Asian, and minority ethnic. So we produced one report looking at all the responses. And from that, we decided to look into specifically Black, Asian, and minority ethnic responses. And that's how we produced our second report. Next slide, please. So for both of our reports, we looked at overall themes and trends. However, there is a potential for us to actually look deeper into the responses. So we had a volunteer look into specific responses for this presentation today from those who identified as having a disability and as BAME. So before I come on to that, I just wanted to give an overview of some of the key findings from our BAME report. Next slide, please. Thank you. So within our BAME report, we identified that the most impacted groups were those with disabilities, mental health conditions, long-term conditions, and those aged 65 and over. So those with disabilities identified themselves as being at higher risk of contracting COVID-19. So when it comes to information and advice, those individuals were less likely to know what to do when it comes to keeping safe from the virus. Also were less confident when it came to using technology, especially with most services moving online. Next slide, please. So the BAME report identified key areas of potential inequality. So we compared the BAME respondents with white British and white responses, and we found that BAME respondents were more likely to be at or care for someone at high risk from the virus and were more likely to have received a shielding letter. And 26% considered using public transport as the greatest risk of contracting the virus, followed by 23% who feared contracting the virus at the GP or the hospital. If we could move on to the next slide, please. So also we found that BAME respondents were less likely to have a stated mental health condition and less likely to be able to access support and resources for mental health needs. And this may be due to mental health conditions being underreported in communities. We also found 18% have said that household relationships have become strained, with household members being uncooperative and unsupportive of others. And when we compare this with white British respondents, it is 11%. So BAME respondents were also significantly more worried about their job or financial security, and marginally more worried about missing school or college and less likely to have access to childcare. Also, a lack of financial support has also meant that people were relying on savings, in some cases unfairly so. And in terms of communication and information, those from white or white British backgrounds found it significantly easier to obtain and understand information and advice, keep a pace of changes in guidance and messaging, and were more likely to find information in accessible formats. And next slide, please, Zainab. Okay, so this table shows a breakdown of demographic information. So we identified 169 respondents with a disability. And of those, 62 identified as Black, Asian, and minority ethnic. So as you can see, this is not a representative of the borough. So we did not break this down into age or gender. However, in future, we would need a bit more time so we can look into this data further. Next slide, please. So we looked at the 62 responses and pulled out some questions. We can see that 23 didn't receive any help from the options above, but Hounslow Community Hub help were of the greatest help, followed by a healthcare provider. And in the table below, we can see that the majority of people found the information they were looking for in accessible format, but a notable size didn't find or were unsure about the information they were looking for. Next slide, please. So we decided to look at this question and what some of the 62 responses said. So we picked out a few of the responses for you to have a look at. If you could move to the next slide. So here's some of the comments, and many respondents have commented on anxiety they felt, being confined home and not being able to see family and friends. Also, the messaging by the government sent out at the time being confusing and not clear. And some of the comments have looked at several issues. For example, if you pick out one of the comments, I'm always anxious and afraid. I get panic attacks as I'm vulnerable. I'm scared of catching COVID-19 and won't be lucky enough to recover. Now I'm worried about my job as they need most of the workforce to take voluntary leave or absence or be made redundant. So these are just a few of the ones we picked out, but there's many more of the 62 comments where people have written a lot of information and how it's really affected them. If we could move to the next slide, please. Okay, so further comments show isolation, difficulty in getting through to services, also some feeling that they are a burden to family and friends who look after them. I will, of course, share these slides for you to all have a look at if you want to. So there has been a lot of learning from this piece of work, including reviewing one of the demographic questions, where we asked people, do you suffer from any long-term conditions or disabilities? We offered limiting options, and we've had feedback that it needs to be expanded to include different types of disability. Like I said before, the online survey isn't appropriate for all. We acknowledge that, and due to the quick turnaround for the survey, we try to put some things in place, such as offering to complete surveys over the phone, offering interpretation services for those who cannot speak English to complete the survey. Also working with various providers to reach the wider community. Also, we didn't expect so many calls due to the survey. So these were a combination of calls about completing the survey, but also issues people were facing in terms of access to healthcare services and anxiety about the virus. And the reports since then have been published, and they were published in September 2020. And we have been presenting the findings at various forums since then. We also made several recommendations, and currently we are following up these recommendations with partners to see what service changes and initiatives have been put in place. So last slide, please. So this sums up basically what we did. So thank you for bearing with that. I know there was a lot of information and it was a little bit longer, but are there any questions or any thoughts, comments?
Thank you, Mystica. That was a really detailed research that you set up there. Jane has been taken away on some family emergency, so I'll be taking over. I was just looking at the, something that struck me at the presentation that you put up, Mystica. The learnings that you got and the findings that you derived from this research, would it speak for the other Asian or BAME community areas, or is it specifically that you can only use use these findings for Hounslow?
So we only have so these were only for Hounslow residents and people who access services in Hounslow. So if you lived on the borderline, you could access the survey because you had a GP in Hounslow. However, just to give a little bit more context, so our provider, Your Voice in Health and Social Care, runs Healthwatch Ealing, Healthwatch Hammersmith and Fulham, and other health watches. So at the same time, Healthwatch Ealing did a similar survey as us at the same time. And they were some similar findings from the BAME communities. So I would say, I can't say for certain, I can't say it's exactly the same as it is in another borough, but we can say there have been similar findings. And, for this particular presentation, I know we focused on the overall picture of the BAME community, and on those with disabilities, but there was a lot of that information found in some of the other surveys that were being run in other health watches in parts of London. So I would like to say that those findings can be, were slightly similar across the borough, but obviously, each borough has their own issues and
Absolutely.
yeah.
Based on their demographics, I understand.
Exactly.
I was just trying to get a general kind of a view, because I'm sure this information would have been shared with, CCG, NHS and things like that. And since we're talking about disabilities today, that is, and we've actually found from your research that that's a huge gap there. So I'm sure, you would have, filled into that, fill that information or pass that information through. I see Lynn's hand up there. Lynn, do you have a question for Mystica?
Yes, if that's okay. It was just a couple of points really. The first one is, I wonder if you might be contemplating repeating the survey in, say, a couple of months' time or so, only because obviously this whole thing's gone on quite a long time. And, you know, like you mentioned about this, I'm so glad that a lot of your information was the same as what I'd got about people at risk of losing their jobs. And the people that I've dealt with lately that have lost their jobs are from this community, because a lot of them have been doing like catering jobs, airport catering, and these are the jobs that are going because, you know, they're more at risk, if you like. So I think that that's going to, in time, in a few months' time, we're going to see a bigger impact now of people that have lost jobs as a result of COVID, and that's going to have a lot of health impact as well. And the second issue as well is around that access to GP surgeries. So obviously right at the beginning of COVID, the GP surgeries closed their doors, everything was over the phone. But that's had a really bad knock-on effect for a lot of patients, you know, especially people, I mean, obviously deaf people, for example. I noticed on your stats there about formats, accessible format, BSL was 0. And, you know, a lot of people whose English is not their first language, trying to kind of speak to somebody over the phone, or even if you do get a one-to-one appointment, somebody with a mask, it really adds to that difficulty in communicating. I just think going forward there will be a lot more effects and things coming out, longer term effects, if you like. Do you think you might repeat the survey again in the future, Mr. Kerr?
We were actually discussing this a couple of weeks ago, if we should do a repeat survey. So it is something we are considering. If it will be done, we're not too sure, but we are actually looking into two projects at the moment. So one of them looking at the impact of COVID on Bain community. So that could actually work into this survey. So it won't be the same thing, but looking specifically at how COVID has affected these particular communities over the year. So that is something we're going to be doing in partnership with Healthwatch Ealing. So it's very much in the early stages, and we're still looking at how we want to deliver the project, really. The other thing in terms of GP access, Lynn, I completely agree with that. So now that people can't get access, we're getting a huge number of calls. You know, it isn't just necessarily about just the GP, but it's delayed appointments, not being able to get through to the hospital, referrals. We just recently had someone the other day who said, you know, they haven't heard about a particular patient experience about their surgery, and it's been over a year, and they don't know who to chase up, where to go. We've had issues where people have mentioned repeat prescriptions, and also especially cancer appointments. So there's a lot of delay, a lot of backlog, and there's a lot of anxiety around it. So at the moment, there are some ways that people can get through to certain services, but a lot of it is not straightforward, especially around mental health. We've had an increase in calls for mental health. So we just had the other day someone call in saying they're having a breakdown and they cannot get through to their GP surgery. They don't know what to do. They're not on the system. So it's a lot of low level support calls that we are receiving from the general public who don't access secondary mental health care. So, you know, I've tried to give some of the GP surgeries a ring, and it is a real nightmare to actually navigate. You know, you press one, you're on hold for 20 minutes, you press another number. So while you're having this breakdown, how anyone can get through, it's just a nightmare. So we've been raising these issues with the CCG, the local authority, just to make sure it is on their radar. These are the problems that we keep coming across. You know, what is there in place? Who can we signpost people to? So we are keeping a close eye on, especially access to services. And we will continue raising these with the right providers and the right commissioners as well.
That would be really helpful, Mystica, because actually some of the things I've seen, what I can't get my head round is, for the whole time that the GP surgeries have been closed, or not closed, but that you can't go in for appointments. I would have thought that would have simplified things for the GPs and for the receptionists, because they haven't got patients going in sitting around. Everything's just done by a phone call. And when you have a GP appointment in the old days, you got your few minutes and you went in a little bit ahead, you went in for your couple of minutes, your time was up and off you went. So what I can't understand is why the GPs, if they're not reopening up and letting people go in, why they aren't giving people specific times for phone appointments. The times are really, really random. It's really, it's a real struggle. And sometimes, I'm a carer for my mum, and the trouble, I've had a surgery since 1995 in Hounslow, and I've always said they've been brilliant. But honestly, if anyone now tells me that they've got my surgery, my heart actually drops. My heart sinks, because my mum's been given wrong medication on a number of occasions, no medication on a number of occasions. She's ended up in hospital because of the wrong medication she was given. And then the last time she was in hospital, a few weeks ago, she already had a fractured spine as it was. Not only did she go in because of the wrong medication she'd been given, but when they tried to x-ray her, they pushed her down and fractured her spine somewhere. So now she's got multiple fractures in her spine.
Oh my God.
All of that goes back to the GP giving the wrong medication. So honestly, we do need to look into that, Mystica.
Absolutely.
Yeah.
Experience in this area.
I agree with what you're saying, Lynn. In fact, I think GPs have changed over the last few months, and I totally I have a personal experience having small kids. You tend to frequent a GP with them catching bugs and stuff at school. The wait line would be around 10 or 15 over the years. In fact, when we used to visit the GPs, and now it's around 30 and 40, and you barely even manage to get an appointment, even if it's called up. You keep calling once every day of the week, and you get it at the end of the week. So I don't know, things have changed, maybe because of the rise in stress and mental health, people not exercising, people are getting sick. Maybe there is a rise in people using the service. So
there's been a huge online shift. They're really getting people to use online phones.
Yes.
And it's not appropriate for the patients and the residents we are talking about. It's not appropriate. They need face-to-face, they need longer appointments. And we know that, especially these vulnerable patients, they should be getting check-in calls, and having someone check in for their whatever health assessment or whatever it is. But it's not always appropriate. And if they're waiting for so long on the phone, up to 40 minutes, an hour, we've had someone said an hour, it's not appropriate for these patients. So we are looking into GP access. We are continuing with speaking to patients via the phone. So we are calling people, residents across the borough, listening to their health and social care experiences. We are also taking very small baby steps to start going out into the community. So we've got protocols in place, but we're slowly starting to visit some of the health centres to speak to patients. Patients have been very willing to speak, actually. I think it might be because they haven't had the opportunity really just talk to someone, but we are slowly taking those baby steps and to restart a community engagement within reason, obviously. But so we will be looking into it.
Sorry, no.
Sorry, just wanted to add something here. Mystica, just an update which we had at this forum some weeks ago. I know you did mention that, it's not appropriate having GP appointments over the phone, but for those who would require or who are able to do that, there is this new service started by called Push Doctor, where they register with the GP and they can avail of that facility. So that's just something that was shared on this platform by the medical team who had introduced it. So just wanted to pass that on. Jane, do you want to take over? Amanda has something to say.
Yeah, I was actually just listening to this and wondering, in the briefest possible way, I'll come back to Amanda now, but in the briefest possible way, can you tell us, what do people do when there is a crisis? Because there is nowhere to go to. Health Watch are watching it. Where do people go? You can't get through to the doctors don't come back. Waiting times and waiting lists are months long. How do you find help?
Yeah, exactly. I suppose most of these patients will end up, either residents or patients will end up in urgent care, A&E, where they can get it faster some of the times. However, if you're vulnerable, then you are in crisis. And I mean, we try and, if a lot of the times we try to get in touch with the healthcare providers ourselves, which is really outside our remit. And we're like, we've got a patient of yours that's on the other end. Is there anything you can do right now for them? Do you have any information or initiatives so we can keep updated about where to send residents to or patients? So that's what we're working with a lot of the time, Jane. We tend to chase information. Sometimes, recently we've been getting a lot of emails from yourselves, public health or some of the partners about this is running, we have this open, this is where people can go to. But a lot of the times, a lot of these services are not appropriate, and we find ourselves actually having to chase information and then let partners know where there's a gap. But yeah, if someone's in crisis, there's absolutely not a lot that can be done in that moment. So it's a very horrible situation, and it was throughout the most of the year that was the case, I think.
Yeah, not so very encouraging thought, is it?
No, not at all.
Thank you so much, Mystica.
Thank you.
Does anybody else have anything to add?
I think Amanda had, you put in a note in the chat, but if you'd like to talk about it, and I think we have Yagiel who's joined us.
Hi, Nyoka. Yeah, I mean, there's Amanda here. It's probably not the right forum, and what you're discussing is so significant and empowering and important. I don't want to kind of detract, but I did notice that Lynn mentioned as part of her conversation, and Zainab, and it has been mentioned a few times, that some of the carers are themselves at risk of redundancy and losing their job. And just to remind, I won't go into it now because I said I don't think it's appropriate, but I know we've sent yourself information before which has been shared. And perhaps I can send it on again to you afterwards, the information that Shaw Trust, the JETS and the so the job entry targeted support and the work and health program. We offer a lot of support for people who have been made redundant or would be looking for additional support to find work. So it was sent actually to Samantha and to, oh gosh, I'm not going to remember the lady's name now. I'm not going to remember it. So won't come, but I will send it on to you afterwards separately. We've got a post and we've got a break for the presentation that we did, and it's just to say that we can offer support to anybody who is looking to find work when it's appropriate for them, because obviously there's many other things going on in people's lives. But for some of those carers who have unfortunately been in that situation, have been furloughed and made redundant, that was really all I wanted to say. Is that okay? Thank you.
Yeah, that's great. Thank you. We're coming to a kind of open chat time. If anybody would like to contribute. Thank you so much, Mystica. I'm sure that this is going to leave everyone with lots to think about.
Thank you. I also want to thank you for giving us, obviously, the opportunity to present. We haven't had that yet. It's been a while since I've spoken actually about the report. There has been background work going on, but it's nice to present it again and just inform people what's really been happening, with what we've been finding. So any opportunities like that, please do invite us, and we'll be happy to come along. Thank you.
Thank you. Okay,
So,
anybody, sorry,
yes.
Ragel?
Yeah, so my name's Irigale.
Irigale, sorry.
Yeah, no worries. I always get it. Right, so I thought this started at 11:30. Okay, right. So my name's Irigale, and I'm the information advice officer for Transport for All in. Well, normally we're in Lambeth, but we're all working from home. We were invited, which we're very pleased to be here. So basically, sort of like, I think we're, as some of you might know, we are a DPO, disability person organisation that campaigns for better transport for the disabled people. So the things that we do are signposting for hospital transport, things like dial a ride. We do appeals for any of the door-to-door services, taxi card, dial a ride, freedom passes, disabled persons freedom passes. Over the last year and a half, we've had quite a few successes when it came to invisible disabilities and freedom passes, because the rules are a little bit vague, and most councils seem to think it only applies to people on the autism spectrum, when the rules don't say that at all. So yeah, so basically I think if any of you guys would like to signpost your clients to us, we also the big aspect of what we do at the moment are the effects on the effects of LTNs, low traffic neighborhoods, on disabled and older people. So we wrote a report at the beginning of the year called Pave the Way, which was basically highlighting those issues and possibly the solutions that we that might be out there. Obviously, LTNs is a bit of a fast-moving juggernaut. There hasn't been much consultation. They've just been plonked in places, and we found that, so, the opinions of them are quite varied. We're not going to lie and say that all disabled people are against them, because some people love them, but things like if we had one lady who lived in the middle of an LTN, who had her carers, she had full-time carers with she had a respiratory condition, and basically those carers couldn't couldn't get into the LTN quickly, so because there's only one way in and one or two ways in. So yeah, so there are loads of issues like that. We're gearing up to a campaign around dial-a-ride, because we've discovered very slowly, or very underhandedly, at least, that they have made, or a quarter of their drivers have been given the choice to be made redundant, under the proviso that under the misguided impression that those door-to-door services are not as popular as they once were because of the pandemic, and we can see that it's certainly a concerted effort, certainly a concerted long-running campaign against dial-a-ride and taxicard that have always been Cinderella services, and clients are just not getting what they're entitled to. Yeah, so I think I'm going to breathe now.
Ira Gail, I have to say that you're an unexpected bonus for us. We're so pleased to have you here.
Thank you.
And we'd love to have you back, perhaps to speak in an official capacity, particularly to talk around those stats and that data that you've collated over the last year. And I know the LTNs have caused some controversy over this last period of time, particularly in Ealing, where they have basically closed off roads and access to an entire area, and slowed traffic down to a standstill. So yeah, we would certainly love to have you back if you'd be willing to come and talk.
Yeah, sure. Certainly myself or the communications officer. Maybe if I put her email into the chat, you can contact her directly, and then maybe
that would be lovely.
She's a very very busy woman, but I'm sure she can give you some time. So yeah, so anything like if your clients of any of the organizations, I didn't catch who was who yet, but need any help with street furniture, things, bad paving, buses. We used to do a lot of in.
So, Irigal, you cover the whole of London?
We do. We have aspirations to come out of London, but I think that's a long time.
Okay, that's fantastic. And so the organizations that the CVS support are across the whole of west of London, and probably are representative of the vast majority of small charities and not-for-profits that are working directly in the local community, including many of our support services providing direct support to carers and people with disabilities. So yeah, lots of really relevant issues will come up.
Good, I'm glad that I came.
Yeah.
Good.
Come back. We're here every Friday morning. So you'd be welcome to join us.
Every Friday, but I'll do my best. Okay, so I'll put Katie's.
Sorry, Argel, if you could put in your contact details, I'd love to get in touch with you and maybe set up.
Of course. So what
set you up on the agenda, because we'd love to hear more and give you a dedicated time. And I'm sure today, I think for some reason, because of the weather, people are sleeping in. Otherwise, we have a really good crowd joining us. But
good, yeah.
More would want to hear about it, and we'd love to get you on the forum.
Okay.
you.
All right. Thank you, Noika. Has anybody else got anything to contribute? We've got a few minutes left before we close the meeting. Okay, let me see. Okay, thank you. All right. So what we've got is, just as we come to the end of the meeting, I want to remind you that we have, of course, I'll put in the review form into the chat. And if you can complete that for us, it will also give you the opportunity to add any, it'll give you the opportunity. Sorry, I didn't hear you, Noika.
Sorry, I did that for you. I kept it ready when I thought you.
Oh, okay. Okay, I popped it in again, so that's fine. If you didn't catch it before, it's there again. If anybody could perhaps complete that, and as well put in any comments you have about issues or subject matter that you'd like to have covered. Thank you, everyone.
Oh, just
check that
Thank
there's
you.
no hands, no hands, no. Thank you, everyone.
thank you.
What are you doing, monkey? Oops, sorry.